Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, welcome to the Stem Cell Healing Institute podcast. I'm here with Dr. Sara Figueredo, and tonight we're going to talk about hair loss, a problem that a lot of men and some women have. Doctor, how are you this afternoon?
I'm wonderful. Thank you so much. Thank you so much for having me. It's always a pleasure to be here.
Welcome to the podcast. Doctor, we were wondering how stem cells can help to that problem of hair loss.
Yeah, that's a really good question, Louise. And you're right. It inflicts so many people in general, whether it's males with male pattern balding or any kind of alopecia with women. And there's so many different causes. It could be hormonal. It can be stress, literally the cortisol levels. It can be the diet and things like iron deficiency and things like that. So it's really important to get down to the root cause of the problem and address everything in a very comprehensive manner. And with stem cells, what we do is we take the stem cells from the patient's own body, and it allows the hair follicles to literally regenerate. And so by addressing the local problem and in literally injecting and placing stem cells in the area of the hair loss, along with addressing hormonal imbalances and dietary deficiencies and addressing stress and lifestyle, we have seen some very, very good results that are permanent.
I see. And what will be the treatment? Is it different for men and women, or is it the same treatment?
It's the same type of stem cell. Okay, so we would use the same type of stem cell, but every treatment is very individual. So for male, and that's a really good question, because you sort of prompt me to specify male versus female.
And I will tell you why I'm asking. I'm asking because my wife suffers from hair loss, and I also suffer from hair loss. You know that.
Okay. Yes. So yes, and it's really good that you prompted me to answer this question, because it's the same type of stem cell, but it's very, very specifically, not only specifically placed, but also the whole treatment is specific for the patient as an individual, and it's personalized, because it can be very different from between one male and another male, and even between male and female. And like I mentioned, for instance, I would want to look at your hormone levels, okay, your testosterone levels. I would want to look at your cortisol levels. I would want to look at certain dietary deficiencies and perhaps level of iron, for instance, and various different minerals and trace minerals. Sometimes that can affect it. And also digestion and absorption and assimilation of nutrients, because a lot of times we're eating the right foods, doing the right things, but our body's just not using it correctly. So there are so many different factors. And so I would treat you differently than the way I would treat your wife, for instance. And I would most likely treat you differently than I would another male. Okay, because not everybody's the same. And people's diets are different, people's lifestyles are different, their metabolism and bodies are different, their hormone levels are most likely different. And so, and there are hereditary and genetic factors for instance, with male pattern balding. And we would address that also. And so I hope I answered your question.
Oh, of course you did. I was wondering if this treatment would involve some pre-treatment before you do the actual stem cell.
Okay. Yes. Okay. So we always do a pre-treatment protocol.
Okay.
So considering what we're treating, there is a specific and as I mentioned, a very personalized pre-treatment protocol. So with male pattern balding, for instance, and if we find that the cause is specifically hormonal, we would first of all want to look at all the blood tests and address the imbalance in the hormone, as well as any dietary factors, and we would place the stem cells specifically for male pattern balding, so that we can get a regeneration of follicles and hair growth. And so that's part of the pre-treatment. And along with the pre-treatment, there are certain key supplements that we implement, as well as certain key exercises and things that we may want the patient to do as an individual on a personalized manner, in order to have the best possible outcomes during and after treatment. So yes, there's the pre-treatment protocol, and then the treatment itself, and then a post-treatment, which is pretty much a continuation of the pre-treatment.
And we can see results like no, I suppose it will take some time to see the results, right?
Yes.
Because it's not like a magic potion either. It will take some time.
That's Yes, because
Okay.
you know what happens? You know what happens is a couple of things. We need to, it takes time for the body to come in balance. So when we
Exactly.
do implement, say, hormones, for instance, it's not going to be overnight. It may take a couple of months for a really good balance. It takes up to 3 months for the full effect of even hormones. And with the stem cells, it's about the same. It takes about 3 months to really see the full effects. And because not only does it take time for the hair to grow itself, but it takes time for a regeneration and reconstruction of the follicles themselves. And so a good 3 months is what we always ask our patients to be patient with,
That is
is giving it some time.
that is great news for us that are losing her. But
Yes.
doctor, I heard there's a lot of people having issues with hair loss now that COVID is around. People that had suffered COVID, they have hair loss, right?
Yes, that's a really good point. I'm glad you brought that up, Louise, because um, we are finding with a lot of patients, and even in our own research, is that post-COVID sufferers and post-COVID patients are experiencing months and months of hair loss and hair thinning, and also post-vaccine. We have encountered, and some of the research has shown that there is also post-vaccine hair loss, and we have been able to address this and restore this with a combination of not necessarily stem cells, because we've seen that the with a lot of patients the hair loss diminishes after a few months. Sometimes it takes time. But also, therapies like platelet lysate, which are the growth factors from the patient's own blood, as well as I mentioned earlier, dietary and other factors to balance. And so I'm glad you brought that up, because hair loss has been a big sort of sequela to COVID and the COVID vaccines. So with very severe hair loss, we have addressed it very successfully with stem cells, and it's been a light at the end of the tunnel for a lot of patients.
Wow, that's great news because yeah, it's incredible what COVID has been. Well, what we've been discovering about COVID, especially post-COVID.
Yes, and I think what most people are not too keen on discovering are the side effects of the vaccines in the long run. So let's just cross our fingers and hope for the best, and just maintain, a positive attitude and a healthy lifestyle. And I'm sure that we'll be able to overcome any kind of sequela, even from the post-vaccine.
So, if the listeners want to get in touch with you, doctor, where would they write you an email?
You bet. That would be info@stemcellhealinginstitute.com. And they can also visit us on Instagram and Facebook, and visit our website at www.stemxcure.com. That's stemxcure.com. And they can reach us at 209-690-7836. That is our US number. I'll repeat that. It's 209-690-7836. And our local Central American number is plus 502-4220-7297. That's plus 502-4220-7297.
In case you want to follow our YouTube channel, you can find the link in our website. And that's Dr. Sarah Figueredo for you guys. So it was a pleasure talking to you this afternoon about this interesting subject. I don't know if you want to add something up, Doctor?
No, I think that's it.
Okay.
Thank you so much, Louise, for having me. And I look forward to our next podcast.
For sure. Okay. Thank you very much, Doctor. Have a good night.
Thank you. You too. Bye-bye.
Bye-bye.